We're getting you breaking news from West Bengal now. The BJP has made a big charge against the TMC-led government there. He says that Bengal numbers have been disparate. The TMC is hiding. The BJP has also submitted a proof of suppression of these facts by the Mamta-led government. They claim that families are forced to give an undertaking, and that is how the West Bengal government is underreporting the number of COVID-19 positive cases in the state of West Bengal. This is not the first time the BJP has made such a charge. Just a few days ago, BJP's Amit Malviya had come out and accused the Mamta government of underreporting the facts. He claimed there was disparity between the figures that was being put out by the state government and that was being reported from the hospitals across West Bengal. Mamata Banerjee had come out and said that this is not the time for politics. Now the BJP has yet again reiterated that very charge, also put out what they claim is proof of the Mamata government suppressing the facts in the state. Tamal is joining us live with more on this. Tamal, a big political fight there brewing over whether or not the numbers of COVID-19 positive cases in West Bengal is the truth or not.
Well, Poonam, we have to understand the state government is on record suggesting that they have constituted an audit body. Now, the job of the audit body is to investigate and find out whether patients who have died because of comorbidity factors or because of COVID, it's something that they want to investigate, as whether the death of a patient, even though who had developed COVID-19 and had tested positive, can the death of the same patient be attributed to COVID or the other comorbidity factors? Now, the state government had defended the decision of having the audit body, something that BJP had questioned in the past. Now, what is now coming to light that Kolkata Municipal Corporation has its own data of number of people who have died, and that number of people, as per Kolkata Municipal Corporation, stands at 10. Now, there is a clear...
Sorry to interrupt you there. BJP MP and Union Minister Babul Supriyo now joins us on the phone line. So thank you for speaking with us. This is the second time the BJP has come out and made this charge against the Mamta government, sir, that there is underreporting of facts. The number of COVID-19 positive cases in the state of West Bengal are far higher than what the state is revealing.
Well, you know, it's not a charge by BJP and put it straight in that. It is not really to ensure the right picture comes up, because we have seen audio data. There is a tendency of people to be careless and see that it can happen.
We believe to have some audio issues with Babul Supriyo there. We will try and connect with the BJP MP there. Mamata Banerjee so far has maintained that this is not the time for politics. There is no underreporting. But the BJP has now come on record to put out some documents in public domain which they claim are proof of suppression. Babul Supriyo is back with us on the phone line. Yes, sir, we had some audio issues with you earlier. Please go ahead.
Yes, I want to first make it very clear that I am definitely speaking in the capacity of being a part of the Council of Ministers of Honorable Prime Minister, and it's my duty as a MP from Bengal to bring the real picture forward. At least the documents that are floating in the public domain. And there is a lot of credibility in the way they are being presented for the government to come ahead and give an explanation of that. I'll give you first things first. NICED has very clearly said, I've also spoken to ICNR, that 29,500 kits are right now lying with NICED in Kolkata. But Mamata Banerjee government has created two firewalls in terms of how the COVID data can actually be can feature in the medical bulletin that the state government is supposed to do but is not doing regularly, and how they can be, and they are a serial offender in terms of suppressing the data. You'll be surprised to know that in the last 2 days, the number of cases that has been referred to NICED, in spite of the 29,500 kits, is just about 10 and 9, 8 and 9 actually. So the state government is clearly issuing orders to stay away from NICED, because according to the NICED, in the initial stages, the number of COVID positive was 91, while the state said it is only 61. And out of the 3 deaths that they said at that point of time, they said, Mamata Banerjee herself said that 2 died of heart attack and kidney failure. Now, in that case, every patient dies either of a heart attack or a multiple organ failure or whatever. So you need not call any of the deaths corona deaths in that case. Now, the IDFC had recommended that at least 250 tests be done in the 16 districts that the state claims where corona has not reached. But none of the tests have been done. The private hospitals, I have got, senior doctors sending me WhatsApp messages. I don't want to, really release them, but telling me that there are only two places, Apollo and Tata Hospital, who are equipped to do the COVID testing. But now, what comes in the domain is that neither are those tests happening there, nor are the samples being sent to NICET, because Mamata Banerjee yesterday created another committee who is supposed to collect all the samples from different hospitals throughout West Bengal and then decide where they are going to be sent. A very shocking detail of Calcutta Municipal Corporation document, which I'm sure you must have got it by now. It clearly shows that 9 patients have been actually cremated in the Dhapa, which means that they are COVID patients. They were COVID positive, and that's the reason the deaths were caused by that, and that's why that had happened. There are 2 other documents that came to me. One is from a Charnock hospital in Vishwabangla Saroni, where an 80-year-old gentleman had died by the name of Gorachand Dotto, and he died on the 7th at 10 in the morning.
Right.
And on the same day at 5:45, the son has been made to write a handwritten note allowing the KMC to do a burial, to do a cremation, and in that he writes that the entire family is in quarantine. Now, the logical thing is, why will the entire family be in quarantine if no one has been found positive from the family? So there are a lot of discrepancies, and Mamata Banerjee should either go out and say that these documents that are floating in the public domain are false, or accept responsibility that the first signs of community transfer has already started in Bengal, and people should be made aware of the real data so that they're aware that it is a serious situation and they should not take it carefully. And the last point, if you will be shocking images of flower markets in Howrah and all of that. She has opened the flower market, the pan market, the bidi market, and there are thousands of people actually going to the market in the morning trying to buy flowers. So these are dangerous situations in West Bengal.
Right, Babul Supriyo there reiterating that there seems to be a disparity between the figures that are being reported from the state of West Bengal. We are awaiting a response from the TMC. A clarification is expected. But the Union Health Minister also gave out a big hint so far as West Bengal was concerned. He did not name the state, but said that there are some states that are not revealing the actual data to the center, and that is a hindrance in the fight against coronavirus. Listen in to what Dr. Harshvardhan said.
कुछ स्थानों से हम लोगों को अभी भी ये 1-2 स्थानों से इस प्रकार की बहुत ज़्यादा शिकायतें आ रही हैं कि वहाँ से भारत सरकार को ठीक प्रकार से जो रिपोर्ट्स हैं उनको नहीं भेजा जा रहा है। मैं विशेष रूप से बिना अभी उन स्टेट्स का नाम लिए मैं चाहता हूँ कि ये सब हमारे राष्ट्र हित में है। सारी जानकारियां देश के साथ शेयर करना बहुत ज़रूरी है।